Good morning, Paule Pachter. Thanks for joining us on Life Before the Virus.
Life before the virus. Who remembers what life before the virus was? No, it seems that way. But I'm happy to be here.
Our lives and worlds have really changed, and that's what this series is about. It's highlighting people like yourself, the CEO of Long Island Cares, Harry Chapin Food Bank, to talk about how your life and role have been impacted since COVID and what the plans are looking forward.
Well, we implemented our COVID-19 response plan on March 13th, along with our member agencies. As people should know, Long Island Cares, in our role as the regional food bank, we provide support for 374 member agencies. That includes the local emergency food pantries, the soup kitchens, daycare programs, senior citizen centers, residential programs for people. And so we send out on any given year a little more than 10 million pounds of food to provide food assistance to 259,000 Long Islanders. That's a real number. It's a number provided to us by the U.S. Department of Agriculture and Feeding America, where they track the number of people who are living at or near the federal poverty level. And when you take that number of people who are eligible for SNAP assistance, the food stamp program, and then you add to that another 2/3, which represent the number of Long Islanders who we refer to as the working poor, people who are making upwards of between $45,000 and let's say $70,000 a year, that still can't manage to put nutritious food on their table. So when you put those numbers together, those two numbers, the people that receive SNAP and the people that are working poor, you come up with 259,000 people. And that number has stayed constant now for 2 years. Even in the height of the COVID-19 pandemic, that number really hasn't increased. What's increasing now is the number of people who have been furloughed or laid off or now are permanently unemployed. Because as you know, currently, we're looking at about 40 million people who have applied for unemployment insurance. Some of those people are coming back to work as the country goes through phase 2 and phase 3, no different on Long Island or in New York. But I would probably guesstimate that 1/3 of them are not going back to work, that businesses have taken such a significant hit because of the lack of customers, the restaurants, what have you. More people now working remotely, and therefore we don't need that many people on site at the workplace. So I think 1/3 of the people that are currently unemployed will remain unemployed. And that will drive probably an additional 20,000 to 30,000 people to the food pantries here on Long Island, including the ones operated by Long Island Cares. So that, Sky, is the scenario that we're looking at right now, and what we can do for the next 6 months as we all watch and wait and see what happens.
So that's kind of thinking you're preparing for 20 to 30,000 more people to enter this system that you will have to take care of.
Yeah, and entering the system for ongoing support. You can go to a local food pantry now once a month and get emergency food. But there's nothing stopping you from going to a different pantry every single day. And people do that. There are many people here on the island or across the country that, for lack of a better word, pantry hop. we're prepared for that. You know, ideally, if you give somebody an emergency box of food that lasts between 3 and 5 days, what are they supposed to do when the 3 or 5 days are over? They have to find another location. And so they find it. Look, right now we have 315 pantries that are open. Unfortunately, very few of them are open full time. On average, the pantries are open 2.5 days a week. So it really does force people to go to different pantries in different communities to get assistance. Long Island Cares is one of the few organizations that operate food pantries 5 days a week, full time, 40 hours a week. There are a handful of other organizations that do that as well. It's important. But as we're looking at COVID-19 and what we can do for the next 6 months, the first thing was to shore up our assets and resources. And so on March 13th, Long Island Cares employed 53 people. Today, as we speak, there are 82 people working here. We've hired that many temporary workers to drive our trucks, to staff the 25 pop-up locations that we're developing with the town of Hempstead in Nassau County. Again, for the next 6 months, for the long term, to see what's going on. What we've been able to do with our pop-ups and with our satellites is we really vet everyone who's coming to us for food assistance. We at least have to know their name and address. We need to know how many people are living in their house. That's the only question we ask. And the reason we ask that is because much of the food that we distribute are government commodities provided to us by the USDA. And the requirements are that you need to provide that food in the region that you're operating in. So if people come to us from Nassau and Suffolk, they're going to get emergency food. If you come to us from New York City, as has been happening for the past 3 months, we're going to help you. We're going to give you a box of food, but we're also going to let you know that here are the pantries in the 5 boroughs that you can go to. There's no reason for you to come out to Long Island to get an emergency food box. So that's what we're going to be doing for the next 6 months. We're going to be operating out of 25 different locations. We're going to be working with a crew of 83 people, maybe another 2 or 4 that gets hired. We really have taken all the necessary steps to make sure that our work environment here is safe and that we're looking at the well-being of our staff. So sure, masks and gloves and face shields and hand sanitizers and getting your temperature taken every day has really become standard operating procedure at Long Island Cares, as well as through the other 199 food banks across the country.
Wow. So you're probably one of the only industries that has hired. You almost doubled your staff during COVID time.
Well, we've been very fortunate over the last 9 weeks, 9.5 weeks, to have received incredible financial support for our work. The donations that we've received are coming in from all over the country. It's not just New York, it's not just Long Island. We have strategically placed ourselves in a model that at this current time, most food banks have steered away from. In other words, most food banks across the country, as you've probably seen on the news, these massive drive-through distributions where thousands of cars are lining up in huge parking lots and getting food and going on. That's not our model. Our model is to support the 315 food pantries that are open and ready to serve their local community, to make sure that we're pushing out about 1.2 million pounds of food every month to support those agencies. Long Island Cares has 6 other locations that we work out of. We have satellite centers in Freeport, 2 in Lindenhurst, 1 in Huntington Station, and our newest in Hampton Bays that opened March 1st. And where we have our own food pantries. We also have a series of 7 mobile outreach programs where we deliver food to homebound seniors, veterans, the homeless, children on the weekends who are not getting school meals. We have 2 food trucks that go out Saturday and Sunday to provide breakfast for kids in need. And so we just kept that going. As we continue to promote what we're doing, people started to turn to us for a long-term response, including the other food banks in New York State, of which I chair the Food Bank Association for the state of New York. So we didn't change our model. We didn't go into these drive-by distributions. We applaud everyone that does them. We know there are community groups that are doing them, and it's wonderful. The more people that get involved in taking care of their neighbors in need, the better our region is. That's why we're called Long Island Cares. But we continue to focus on our member agencies and our own satellites. And now with 25 pop-up locations for the next 6 months, we're just going to be continuing to provide people who need it with emergency food. And at the end of April, we were able to identify approximately 17,000 people who came to us for assistance who've never been to a food pantry before. So when local government or the media, wants to know, what are the numbers like? What's the increase like? We have the unduplicated number, and we'll have a new number in about another week and a half, which I anticipate will be over 20,000. So we have a pretty good projection as to what's going to take place in the long run and what we need to be prepared for. And we're sharing that not only with our local government, but also sharing it with Feeding America, because they're looking at this unduplicated number across the country. How many of the 40 million who now applied for unemployment are going to need emergency food moving forward for the foreseeable future?
Right.
So it's big. But I think as an industry, and I really have to hand it to Feeding America, they are the best at this. Who thought about their local food bank on March 12th? Nobody really.
Right.
They knew they had a food bank. They knew, send $10, send $25, let's do a food drive. Food banks have emerged in the last 9 weeks, secondary to the healthcare profession. That when you look at the essential services, we need to keep people well and healthy and deal with their medical issues. But right behind that, even before law and order, we have to feed them.
Right.
And that's why food banks have become so popular right now. It's the in thing to do. Support your local food bank. But we are so blessed with the kind of incredible support that we've received from all over the country. And it's continuing. It's been nonstop for the past 3 months. There's not a day that goes by that we don't get a nice letter or a wonderful email. We have actually raised more money in the last 9 weeks than we did in the past 9 months, because people are responding. And, look, we were not ashamed about what we do, but we're also out there promoting who we are and telling people the story. So sure, we've been running commercials and radio ads and billboards and stuff like that. No different than Northwell Health. We take their model, even though they're a for-profit, and we're a nonprofit. We're still a business. We still have to get our message out. We still have to let people know how they could access emergency food through Long Island Cares. And then, of course, there's our reputation that we've built over the past 40 years. And, despite the fact that Harry's been gone for 40 years, he's a man whose legacy still lives on, and people still relate to that. So we're very lucky.
Thank you so much for everything that you do, and
Oh, sure.
appreciate your time and for all of your insight into how this works.
It's charting new ground because, you know, this is something that anyone that's followed the reports and listened to the governor and the experts, this is going to be around for a while until there's a vaccine. And we'll continue to focus on the need to be isolated and, you know, social distancing. And then there are other people that have no problem, you know, playing Russian roulette with their health and are happy to go out without masks and no social distancing and defy whatever science is telling them. And we're both going to learn a lesson from it. It's unfortunate that, you know, while we're dealing with the COVID-19 pandemic, that also the country is on fire. And this is an interesting time to be working with people in need. It's very difficult, but we're going to get through it. We'll be okay. We'll come out on the other side. As I told people, we are now delivering food safer and smarter, but we're still delivering food.
Right. Thank you. Thank you so much.
Thank you. Thanks for having me.